Pause up, everybody. Welcome to Meowy Hour. I'm your host, Arden Moore. And again, this show is presented each and every Wednesday by the Cat Fancier Association. And joining me today, we've got one of our ginger boys. We've got Rusty the Performer here today. And I also want to welcome our co-pilots from the CFA, all breed judge, Kathy Black. Hi, Kathy.
Hi.
Yeah. Kathy, Rusty says hi.
Hi, sweetheart.
And we also have all breed judge from the CFA and editor of Cat Talk, the one and only Teresa Kiger. Hi, Teresa. Where's Phoebe? Where's Phoebe? Rusty wants to know.
She curled up asleep.
Oh. Hey, guys, February is National Pet Dental Health Month. And we're keeping our paws crossed because we're hoping our very special guest, a veterinary dentist of distinction, Dr. Ben Colmery. Oh, he's calling me right now. Hi, Dr. Ben. I'm on the show right now, live. Okay, he's saying everybody, his computer's giving him the hardest time ever. Can I ask you, Kathy Black is going to call you right now. If you can take her call while I continue hosting, would that be cool? She's going to call you on this number, so it's going to come from, all right, thanks. Oh, this is fun. I love technological hiccups because we're in a doozy of one. And Dr. Ben is trying to get in, but apparently he needs to perform surgery on his computer. So if worse comes to shove, we're going to have the voice of Dr. Ben.
That's okay.
Maybe we can do that. We can do audio. We will have the technology. But as I said, February is National Dental Pet Health Month. So think about it, guys. We need you to be down in your pet's mouth because a lot of things can happen in the mouth that could impact other organs. And who wants a doggy kiss from a cat? Not me. How about you, Teresa? Do you want a doggy kiss?
No.
Also, guys, it's fitting that this show today is brought to you by Pet King Brands. They are the makers of Zymox and Oratine. Oratine, they actually have a whole family of different products for good dental health for dogs and cats, including this one right here that I use every day in the water bowls for my furry Brady bunch. You just squirt it in the water and it is a brushless water additive so that the kitties and the doggies have good dental hygiene. That's pretty cool, don't you think, Teresa?
It is. I just started using that with my crew too. So
yeah,
I'm hoping to see some really good results.
So the nice thing is, guys, you can use a finger brush. You can use a little swab. You can use these with products from Oratine. Has a whole family of products. I have everything from a 90-pound dog named Bujo to little Rusty the Performer, but I really want to make sure that they have good, healthy gums and good, healthy teeth because that keeps them healthy for a long, long time. So we're going to talk more about that, and we're hoping, poor Kathy is on the phone with Dr. Ben trying to get him on, so we're hoping that we can get him on the show. But to start the show, I would like to talk to you about something fun that happened to me this week. A good friend of mine, Joette White, you guys might know her. She is the president and founder of Park City Pet Sitter. It is in Dallas. She's a former Pet Sitter of the Year through the National Association of Professional Pet Sitters. And about, I don't know, a month and a half ago, people kept seeing this Bengal cat running around with no collar through this part of Dallas called White Rock Lake. It's a beautiful, it's like Central Park, only in Dallas. And nobody claimed her, nothing. She rescued this cat and we figured it out. This tiny little cat was mega pregnant and gave birth to 7 cats that do look like Bengals. Me, share the screen.
No, Kathy shared the screen.
Oh, okay. Yeah, she's doing it. So I wanted to talk to you about that. I got to hold 9 kittens. Can I share the screen with my picture if I do it?
No.
Oh, okay.
Hang on, I'll get the picture up for you.
Okay.
Thank you.
Thank you, Kathy. I know you're doing triple duty right now, Kathy. So we're going to show this picture, and I'm going to ask Teresa to help me out because
so
Teresa knows.
Look
at those kittens, Teresa.
Right.
They're 9 days old, which means what? They don't have their eyes open, right?
Eyes aren't open. They can't hear.
They're getting close to having their eyes open.
Yeah, but they can't hear my bad jokes?
No.
Yep.
I told them I was just kidding. They didn't get it. Okay. But we don't know if they are Bengals or not, but the mama sure looks like it. And the weird thing about the birth is she gave rapid fire, and then another one came out about an hour, another one came out 2 hours later, and the final one came out like 4 hours after the first one. Is that normal?
That's pretty fast for that many kids.
Yeah, that's really fast.
Oh, it is? Oh, I thought they all popped out like toast.
Oh no!
It can take a day or more sometimes. So,
really?
Yeah. But
yeah. Sometimes they say
once they start coming, they come pretty fast.
Well, I just want to salute Joette White and the team at Park City Pet Sitter because they're taking care of Mama and the babies. And obviously she works with her veterinarian and all that. And she asked me to come to the place because apparently Sweet Farah, that's the mama cat's name, turned into Satan Kitty. And as a behaviorist, I can tell you this, maternal hormones can turn into maternal, right? So this kitty was kind of aggressive.
They're in pain too. And when they're in pain, they don't want to be messed with.
So I used a lot of the fear-free pet techniques, and I told her to get those, you know, when you have a storage bin, those plastic lids. It's a nice thing. It's almost like a suit of armor, and it's lightweight. And I said, drape a heavy towel over your shoulder. And we arranged it so when Mama Cat is eating, we can quietly shut that room off so she can tend to the kitties and the litter boxes and all that. And it's a win-win for Mama and the team at Park City Pet Sitter. So without getting the cat further agitated, we were able to calm her down and be able to have her get proper amount of nutrition and a little away time for the babies because there's a 7, the magnificent 7. So anyway, so what's the word with the good doctor?
He's going to try to call us. And so I hope I actually see him try to come in as a phone call. His computer is doing an update and he can't do anything while it's in the middle of an update. So
okay,
he said he was going to try to call us.
All right. Well, we appreciate that. As you kind of monitor that and you get a special triple medal for doing 3 million things at one time, Kathy, we do have some last minute voting opportunities still for the benefit for Sterling Trap King Davis. Remember, everybody, he was on the show last week along with Mary Tan of Whisker Media and Nathan, the cat lady. So you want to take that over, Kathy?
Sure. I just want to say that we are no longer accepting entries. We're now into the voting. And
okay.
It's only $1 a vote. And of course, your money goes to a very good cause. You go to the website, vcc.cfa.org/TrapKing2021. And as you scroll down here, you can see the top vote getters. So here is Penny. Penny now has 327
Wow, Penny,
votes.
you go, girl.
And Lord Feet is up to 276 votes. And so you can go.
I've heard of Cherry Garcia ice cream, but I've never heard of Pepsi Garcia.
Pepsi Garcia. And then we have Paprika and Dirty Harry and Aaron. So you can either look through this and see who's getting the popular votes, or you can go to each of the category under the gallery, and you can go to like the beautiful eyes competition level.
Let's just go down the categories really quick, if you don't mind, Kathy.
Yeah, well, we have the main event, which features all the cats that were entered. We have the beautiful eyes, the best furry and fur-less friend categories. We have cats in costumes, cats needing homes. Now, these were free. Anybody could have put a cat that's up for adoption on this page. It has their website and their location and the cat's name and age and that kind of stuff. We have Gotcha Day, which is being judged by Arden. My cat.
And I already made my top 10 picks, but I can be persuaded. I will not bribery, don't worry. But I got to tell you, there was a lot of entries in that one, and you really did feel that energy between the cat and the person of, oh my gosh, this is great. I got you, and you got me.
We have My Cat Lady or My Cat Daddy, the outdoor cat photography, the imperfect cats, those special needs cats, and the tricksters and the performers and the show-offs, and Where's Your Cat At, which is going to be judged by Trap King. So
I love that. That would make an English teacher cringe, ending with a dangling preposition, right? Where's your cat at?
Yeah, between the A and the T, right?
Yeah.
So you have 3 days, 8 hours, 48 minutes, and 37 seconds to go out there and cast your vote. You can pay with PayPal. You can pay with, oh, good, here he comes. You can pay with PayPal, or you can pay with a credit card. And it's, like I said, it's $1 a vote. You can buy them in blocks of 5 or 10 or 100. Everybody go out there and vote for a cat.
Is there any way we can have a photo of the good doctor? I know he's really doing surgery right now with his computer, but do we have something so we can show Dr. Ben? I know we have a couple pictures. Do you want to welcome him on?
Yeah, he's here.
I'm not sure you want to see me.
What's that? What did you say, Dr. Ben?
Do you really want to see me?
Yeah, if you can, but I don't want you to mess up the connection.
Oh, no.
Hey, everybody, let me at this time properly welcome our special guest today. He is Dr. Ben Colmery the third, not the 17th, the third. And this guy's kind of a pioneer in veterinary dentistry. There's a lot to say about him, but I will say this. He founded the Dixboro Veterinary Dental and Medical Center in Michigan. You were an adjunct professor, I guess, at Michigan State, your alma mater, correct?
That's correct.
And there's some fancy title that you helped with the world of veterinary dentistry for animal cares. You are the co-founder of the American Veterinary Dental Society. That's like, Gutenheimer, inventing the Bible or something. I mean, that's like the big deal. There you are at work. Don't you look good there? Can you see that?
I think I had more. I think I had more hair back then.
Well, we'll just keep the net on. But we are delighted. Welcome to Meowy Hour. As you know, this is sponsored by the Cat Fancier Association, and we air every Wednesday, and we are there for all cats, purebred and otherwise. So what do you think about being a guest on a show called Meowy Hour?
Well, it's a real honor, to tell you the truth. I really enjoy these things. I tell people that my clients that come into the office that here's the deal. Aliens came to Earth 2,000 years ago, built the pyramids, and left the cats. And that's how we got kitties. Kitties are a unique creature, and I love working on them.
Oh my gosh. We are going to do some other things during the show, so you do not hang up the phone. You promise?
Nope, I promise.
Right.
So I'm trying to log in. I'm working on the Zoom login, so we'll go ahead and talk, and I'll try to multitask here.
Okay.
So once I see you coming in, I'll admit you, and then you can hang up your phone. Okay. So
what's the worst dentist joke you've ever been told? I have one, but I'm sure you've heard it.
Oh, gracious. The problem is there's so much truth in all the jokes. It's hard to know what's really truly a joke. And so you tell me yours.
Okay. What's the worst time to book a veterinary dentist appointment?
Haven't the foggiest idea.
2:30.
Well, there you go.
Like Tuesday.
Like 2:30. All right. That was really bad, wasn't it?
Yeah, that was a stretch.
I know, that's all right. That's all right. But we want to talk about, if we can, I've got to do a trivia contest real quick, if you don't mind, Dr. Ben. Don't
Okay.
answer the question because we give the answer next week. You promise?
Sure.
Okay. So, hey, guys, last week, our trivia contest question was, cats are perfect to be social media darlings. So, which of these celebrity cats has the highest number of followers on Instagram? And it turned out to be Nala Cat with, ready for this, guys? 4.3 million Instagram followers. Now, Dr. Ben, are you a big man on Instagram?
I have so much stuff on my plate. That's not one of them. No, I'm not an Instagram kind of guy.
Okay, so you're not competing at all with Nala Cat.
Oh, no, not at all. Not in the least.
All right, so here comes and the winner of that is going to win a basket of goodies from our great sponsor, Pet King Brands, the makers of Zymox and Oratine. Take it away, Kathy, announce the winner.
That was Amy Johnson from last week.
Amy Johnson.
Yes.
All right, Amy, can we show the picture of the products?
I'm bringing it up as we speak.
All right, she's on it, man. This lady gets triple medals today. So does Teresa. We're making it work.
She had a little extra help there to deal with that.
So you guys, this is a big deal. Now, Dr. Ben, I know you know about Zymox and Oratine. What's your thoughts about
products?
Yeah, what's your thoughts about, because Oratine gives people a lot of options. You can do, a gel like I have the water additive. There's a lot of different options, especially if you're trying to mess with a cat in their mouth, right?
Right. Well, what I find particularly effective are kitties that are older cats who have poor renal function, and they have a problem called xerostomia, otherwise known as dry mouth.
Oh.
And a lot of those cats really are benefited by the Oratine products. It doesn't replace saliva, but it just makes oral mucosa a lot more comfortable. It's a problem with older cats, and the symptoms will be lip smacking, and they're just kind of smacking their lips all the time, and
Wow.
look at food and sort of eat and not eat and kind of pick at it. But the kidney values will be elevated, and what happens is the body diverts fluids from the salivary glands to the kidneys, so their mouth dries up. And they have cotton mouth. I can't tell you that, but that's what happens.
So the phrase "cat got your tongue" is a real serious condition.
Yeah.
And I'm not being funny. I'm just saying that's an eye opener. What do you guys think about dry mouth? Did you know this, Kathy and Teresa?
No.
Yeah, because
No,
I've had one cat live to be 21, and I remember Corky was doing some lip smacking. Gosh, that was some time ago, but now you've helped me be more of a pet detective for my pet's health.
Yeah, I've had enough where they don't want to eat dry food because their feet hurt.
Yeah, well, that's one of the other things too, is they prefer things that tend to be a little more moist because they're not making spit.
Oh, I love how you use medical terms. Spit. You had me at spit.
Yeah, there you go. Well, you got to use stuff that people can understand and relate to, and that sort of business. And I'm too old and crabby to try to remember all those big, long, fancy words. If it has more than one or two syllables in it, then I'm lost.
That's why I love you, man. I wanted to let you know you were quoted by me in Dogster magazine, and I do a blog for Pet King Brands. So your name is everywhere. You're a star.
Oh, well. Yeah, I need to take a low profile.
I guess we're not going to see you on the Hollywood Walk of Fame?
Probably not. No, I'll be too busy in my office taking care of critters.
I like that. That's a better priority. Hey, the question we're going to give everybody today, so get ready. This trivia question, and again, if you know the answer, Dr. Ben, don't say it because they're going to be told next week. There's a new TV show out called Meet the Mayor, and it stars Ted Danson. Do you remember him from Cheers, Dr. Ben?
I watched Meet the Mayor.
Oh, yeah.
Yeah, and I watched Meet the Mayor. It's really funny. It's Tina Fey's one of the producers. It's got who's the deputy mayor? She's also an Oscar winner.
I can't remember her name.
Okay. Well, anyway, there's actually was a cat roaming in a town in Alaska. It's called Taknita, Alaska. Lived to be 20 years old. And this cat was the honorary mayor of that little town in Alaska. But you're going to like this, Dr. Ben. This cat, we're not going to give the name yet, would actually every afternoon go into this restaurant bar and would be given a water with a little swirl of catnip in it. I guess he needed his happy hour early, huh?
Well, don't we all?
Meowy hours for everyone.
Yeah,
we know that.
For everything. I'm not going to say the name of the cat yet, but this cat was found in a box of kittens in a parking lot way back when. And he actually was featured in an effort to protest a Senate race in Alaska in 2014. And people urged voters to write this cat's name in as a mail-in, as a write-in candidate. He obviously didn't. He didn't make it, even though he had bipartisan support. Oh, that's bad, right? Okay.
Yeah.
All right. So I want you to know we're going to find out the name next week, but here are your choices of this kitty's name, who is a legend. Was this kitty's name Sam, Sean, Stu, or Stubbs? Don't answer anybody, but they're all starting with S. They're all male names. Was this legendary cat from Alaska who was mayor for 20 years, honorary, Sam, Sean, Stu, or Stubbs? Do you see how high level of knowledge base we have on Meowy Hour, Dr. Ben?
Well, I'll tell you, you're just right up there at the top.
Well, we believe this. If you can laugh a little bit while you're learning, don't you think that makes the day a little bit better?
Oh, absolutely. Absolutely. No, I fall asleep in the really serious lectures.
All right. Well, promise I won't do that to you. So I want to get into
Good.
some weird things about cats, and you're the man to ask. Number one, I understand the way the mechanics, the way a cat's jaw is created, that they only can go up and down. They can't side to side. Is that right?
That's absolutely correct. Cats are obligate carnivores.
And so what is the deal? Why can't they go side to side?
Well, their teeth are designed to tear and cut. They're not designed to chew. Kitties don't have occlusal surfaces like we do. They don't have areas in their teeth that are flat to crunch down. Dogs do, cats don't. So
Really?
their teeth architecturally are designed as scissors. So when they catch their little furry creatures and stab them with their canine teeth, then they take their incisors as they would scissors and just cut the flesh with it. And so in order to be able to do that, you can't have teeth going sideways. When teeth close, or the cats close their jaws, the teeth overlap, and that's what prevents the lateral movement. But they are obligate carnivores. It's the way God made them.
I love this. Isn't this great, Kathy? Did you know that?
Yes.
Oh, okay. The other thing I found out trying to prepare for you on our show, their front incisors are used mainly for grooming to remove fleas, maybe?
Well, maybe yes, maybe no. The $64 question, are incisors in kitties even functional? I mean, they're pretty wimpy little crowns when you really look at them, and you kind of wonder, what's the purpose of those things? What do they do? I think their tongues are infinitely more efficient in grooming and cleaning themselves than the incisors. With the barbs on their tongue, that's how they get food in their mouth, and that's how they get their salivary proteins and their IgA on their fur. I'll tell you, here's a little trivia for you. If you ever want to stimulate a veterinary dermatologist and drive him out of his mind, put an e-collar on a cat so it can't groom itself for a couple of weeks, and it'll develop some pretty gnarly looking lesions, and take the e-collar off and just say, I can't understand what's happening. Where'd all this come from? And the really astute dermatologist will say, "Yeah, you had an e-collar on, didn't you?" But the rookies will look at it and they'll drive themselves bonkers trying to figure it out. The salivary proteins in their mouth are really important. They really are.
Well, I wanted to introduce you to Rusty the performer. Can you see him, Dr. Ben?
Oh, all I can see is a blank computer screen that is driving me freaking nuts.
Well, what we're going to do is after the show, Kathy Black will send you the YouTube link. So you will actually get to see the show whenever you want. Isn't that nice?
All right. Well, that's a plan.
But I wanted to ask you about I have a big cat. His name is Pet Safety Cat Casey. He is a ginger boy. He's properly known as a red and white tabby. And he is one of the very few cats in the country who teaches pet first aid with me, and he's also a therapy cat. So, the ginger boys, tell us a little bit about what happens to their gums, noses, and eyes. There's some that they get freckles, don't they?
Well, I can deal with the mouth. The eyes, that's out of my territory.
Yeah, I'm talking about like they get little dots on their nose, but he's got on his mouth, he's got a little black pigmentation now. He's 6 years old.
Yeah. Well, think of it as freckles, and I guess that's the easiest way to explain it. There is pigmentation that does happen in animals' mouths, especially kitties and that sort of stuff. And I don't get too excited about the very flat circular lesions that are looking pretty benign. If you have anything, and if the pet owners have a kitty that has a lump, now lumps are a different story. I don't like lumps in mouth. Yeah. Okay. A lump of sugar, that's fine for your coffee, but not a lump in the cat's mouth. That's not a good idea. And
so what if you have the perfect color of a cat's gums? Should they be a light pink or more of a white pink? Or should they be more of a nice fleshy pink? Or I know that red would be wrong, obviously, but so what would be the ideal color?
Well, I think light pink would be the best, to tell you the truth. If anything that is fire engine red, that's not so good. Anything that is lumpy bumpy or has some proliferative changes on it, it's not smooth and flat. We like to see nice, smooth, flat gums that are pink in color. And if you really want to test it, just take your finger and push on it, and you have what's called capillary refill, where the blood is kind of squished out and it comes right back, and it ought to look the same color it did before you pushed on it.
That's what we do in our pet first aid classes, Dr. Ben. Sure. We tell they should be bubblegum pink. They should not be bright red, pale, blue, or yellow.
Yeah, absolutely.
All right.
No, that's exactly right.
Let's talk about doggy breath in a cat. What could be some of the causes, and why should that not be ignored?
Oh, gracious. Well, certainly there are factors that are involved. Animals, and especially kitties and some dogs who have really horrible mouths. For lack of a better term, we'll call it the proverbial rotten mouth. They'll breathe on you and about gas you out. And I'll tell you, as a side note, with all this COVID business, we have been so insanely busy. I'm booked out till June now.
Are you kidding? Wow.
No, I'm not. And what happens, everybody's home. And, the kitties come over and sit on your lap, and the dogs sit next to you and breathe on you, and it about gasses you out. Oh, my golly, Fluffy's got something wrong. And so we've had an insane number of people call up just because of that. Odor can come from certainly periodontal disease and abscess teeth and nastiness and that sort of stuff in the mouth. It sometimes can also come from just the GI flora, the bacteria that's in the GI tract. Sometimes you can get some stinky bugs in there that are hydrogen sulfide formers that will get into the bloodstream, and then they blow it out through their lungs. So, if the mouth is drop dead gorgeous and you just don't see anything at all in there, then what I tell clients is get some probiotics and use that and see if you can get some good guys in there in the GI tract. But I would say probably, 75, 80% of the time anyway, when you have to get a gas mask to be in the same room with the animal, that's not a good sign.
No,
there's something wrong.
when I interviewed you for the radio show, Pet Life Radio, the OBH show, you said there were like 400 types of bacteria that have been identified in the oral cavities of cats and dogs. Is that right?
That's right.
That's an army.
Cats more than dogs. I think the cat's mouth is they say one of the nastiest ones.
Yeah, who's got the dirtier mouth, cats or dogs? We love them both.
It's kind of a toss-up. I would say if you're really going to really analyze it, it's probably the kitty mouths that have more virulent bacteria. The organisms they have in their mouth tend to be a little bit nastier than in dogs.
Okay, wow, that's a lot. And you could have been any kind of veterinarian. What made you say, I'm going to spend most of my time looking in the mouths of dogs and cats and other critters? What drew you to veterinary dentistry?
Well, the short answer is when I was in ninth grade at Slauson Junior High School here in Ann Arbor, Michigan, we had to do a career thing. So I did veterinary medicine, I did teaching, and I did dentistry. Those were my three choices. And somehow I managed to hit the triple crown on that. I've always been fascinated with
triple crown. Sorry, couldn't let it go.
But yeah, I slipped that in there, and I've always enjoyed doing fine motor skills. When I was a kid, I made the USS Constitution, tall ship with all the rigging and all that kind of stuff on there. It's just me. I just like doing fine motor skill kinds of things. Mm-hmm. When I got out of vet school, I realized that we had been taught zilch in terms of the oral cavity. I mean, it was abysmal, my training. And I thought, man, I got to figure out what's going on here, because I'd had all these animals come into my office and I had no clue how to deal with them. So I just said, okay, let's see what we can do. And since that, and then I'll really age myself, because first day on the job was January 2nd, 1969. And since then, it's just been a labor of love. And it's been an evolution, and it's been fascinating to see the things that we could do and the stuff we're able to do for these animals. And it's a whole different ballgame now, completely. But I'll go on a side.
Yeah, Betty White had been active until recently, and she's just celebrated her 99th birthday. I don't think age is a deal. I think your quest for knowledge and wanting to always keep learning and helping, I think that keeps us almost young. Don't you think, Dr. Ben?
Oh, absolutely. You thirst for knowledge, and that's the thing. And every time I turn around, there's some new little thing that's happened. I mean, right now, it's all about imaging. I have a cone beam CT scanner in my office, and I can get a CT on an animal's head in less than a minute. Oh, that's a game changer. When I have, where was this stuff 40 years ago when I was young and spry? Yeah, I can get a CT.
Be patient, grasshopper.
Yeah, I guess. But we can assess fractured jaws, oral cancers, all that stuff in dogs and kitties, in just in a heartbeat now, and it makes a difference in treatment planning. So it's just starting to get fun. I mean, it's some really cool stuff that we can do.
That's exciting. So we have a question from a follower. Yeah, I have a couple of questions, but we have one from a follower. Yeah. Their cat's on anti-seizure medicine. Can that cause bad breath? Like certain medications?
Yeah, it's probably not directly. I would also look, clearly at the oral cavity too, and the kind of food it's on. It's not one of the big corollaries with breath. It's not something that we note on you must be on a seizure med. No, we don't see that very often. So for that kitty, I would look for other reasons.
Okay, but you said for dry mouth, there was some medications can cause trigger, kind of exacerbate dry mouth.
Oh, absolutely. Right? Absolutely. The cardiovascular drugs for heart disease, absolutely. And that's a big problem in human dentistry too, because in the nursing homes, these people crab about their food. And the food's fine. It's just they're on all these anticholinergic cardiac meds, and their mouths are dry as a bone, and they crab about. There's nothing wrong with the food. Yeah. Your mouth is parched, and it's the same thing that happens in animals that are on all these heart meds now. Is that they get the same thing.
There's another question. You want to read that one, Kathy?
Yeah. How do you treat dental absorption? I don't know what that means exactly.
Dental what?
Absorption.
Oh, resorption. Yeah.
Yes.
Yeah, resorptive lesions. Yeah. That is one of the major frustrations in veterinary dentistry.
Wow.
I have been doing this for way too many years. And still to this date, nobody knows the triggers for it. What causes resorptive lesions in cats? Cause unknown. I can tell you that clinically I see a lot more in dogs now than I used to. And I've also noted that it's being reported in the human literature. So what's up with that?
Tell people what is reabsorption. Tell folks what that means.
Okay, all right, I'm sorry, I should. What happens is that for some unknown reason, bone cells in the cat's jaw attack tooth structure. And if you visualize the little video game Pac-Man, what happens is bone cells munch away on tooth structure and convert that tooth structure to bone.
Wow.
And once it starts, it's a one-way road. Back in the 70s, we tried all kinds of stuff trying to treat it, and it was a total waste of time. And it is a progressive disease. For my practice, early onset lesions that are way down at the tip of the root, I leave well enough alone. But when they get near the surface, then those teeth go bye-bye. The way you treat them, there's, depending on the severity of the problem and where it is, there's a technique that I call the DuPont technique, because Greg DuPont is the one that reported it in a meeting, is where we do a crown amputation. When you have a tooth that's just totally gone, the root, you take an x-ray, and interoral x-rays are critical. You have to have interoral x-rays. And if if the root is gone, you just take the crown off and close it down. I had a kitty today with one of the teeth was in that status where the root, where's the root? There's nothing there. And then the other tooth had advanced disease, but still had root structure intact. And so that tooth, I did surgically remove the whole thing and get it out of there. So the way you treat them, early onset, very early disease, you just monitor them on x-rays, and when they get near the surface of the gums, when they're about ready to perforate to the outside, that's when they get sore. Okay, then the teeth go bye-bye. All the other treatments are just...
If you're having ulcers in the cat's mouth, what is generally causing that, and how do you treat it?
Oh, now we're getting into the medicine part, and that's where I have my own very strong opinions. There's a disease people call stomatitis.
I was going to ask you, stomatitis, that's a big one.
Yeah, well, it's like diarrhea. It's a symptom. Stomatitis is caused by many different factors, and the absolute key is to get at the source of the problem, what's causing it. You can relieve symptoms, and a lot of veterinarians will just throw steroids at the animal, and that's fine until all heck breaks loose, and then, send it to Ben. Let Ben figure it out. And then I have an animal who's metabolically wrecked from the steroids. What happens is there are diseases that contribute to it. There are viral diseases. The calicivirus will do it. There are bacterial diseases. Feline Bartonella, the causative agent of cat scratch fever, will do it. And then there are idiopathic ones where the cat, just choose your parents wisely. The cat made bad choices for its parents and ended up with inherited diseases and has a horrible immune system. So what you have to do is rule all that stuff out. And if you have resorptive lesions on top of this ulcerative lesions in the mouth, you got the double whammy. And those teeth are good. Those kitties are going to be toothless wonders. And cats can
eat without teeth, right?
Oh, yeah. Well, as they said, cats are God's gift to veterinarians. They make us look good, and we like that. And that's why I like kitties. Yes, even as toothless wonders, not a tooth in their head. It's amazing how well they will do. As I said earlier, they're oblate carnivores. All they got to do is get something in their mouth the size that they can swallow. They're fine. And I've had kitties that have caught mice. And I'll talk to these owners. What's it do? A body slam? What was it? Was it a retarded mouse?
Maybe it was kitty kung fu.
It's got to be, so they function just absolutely fine. Now, the only caveat is, and I'll tell you stories from clients, if you have a kitty that loses the anterior teeth, the canine teeth, and they go outdoors, which I don't necessarily recommend, but if they do, they need a big brother, because if they get into a political discussion with a neighbor kitty, they'll get their clocks cleaned, because the teeth are the deterrent. So the people will say, Fluffy never goes off the porch anymore. We just don't understand. Yeah, Fluffy got her nailed by the neighbor kitty 2 weeks ago and has decided there's no future in leaving the porch.
So
what's a couple of preventative things we can do? I know it's National Pet Dental Health Month, but we should be doing certain things. What are some easy at-home things we can do just to kind of help keep our cats' mouths healthy?
All right. The phrase that I use is flip the lips. Look in the mouth. None of us have Superman X-ray vision. At least I don't. That's for sure. But at least you can see on the outside what's going on. And if the mouth looks drop dead gorgeous to you, fine. Start with kitties when they're young. Don't wait until they're 8 years old and their mouth is sore. Now you want to look. Kitty's going to say, I have a different idea about that. Start when they're kitties, when they're young, 12, 14 weeks of age, fiddle with their mouth a little bit, get them used to you, flipping the lips and looking. And then for adult cats, look in their mouths. Now, if people are kind of gung-ho, I recommend you take a washcloth, wrap it around the finger, and just wipe the scum off of the upper teeth. The tongue does a pretty good job on the inside, but it's the upper posterior teeth that get the most junk. And just wipe it off. If you want to rub and scrub with a toothbrush, I'm happy for you. The cat might not be, but if you can do it, cool. But I think mechanically just wiping the teeth and looking. As I said earlier, lumps and bumps, we don't like that.
Okay.
Pink holes in teeth where it bleeds, that's never good. Those are resorptive lesions. We don't like to see those.
Yeah.
I think the...
Okay. Well, and I like some like this, so you could just put it in the water bowl every day. Well,
there are lots. There are lots and lots of products out there, and it would be cool if just one size fits all. It doesn't. So you have to kind of tailor it to each individual kitty, and you have to do a little trial and error and that sort of stuff. I will say that, and I'll put a plug in for one of our organizations, Veterinary Oral Health Council. It's a VOHC, and I'm a big fan of that group. And the guy that used to run it was Colin Harvey, and he's probably the most anal retentive person on the planet when it comes to research.
That's a friend talking. Okay, yeah.
Yeah.
Well, VOHC is like the ADA for people, right? American Dental Association.
Yeah, exactly. So products that have that label for sure, that means it does what it says it does. So if people are, kind of a quandary, oh my goodness, look at all this stuff on the shelf. Well, if you see things with a VOHC sealed and Oratine's a good product. I mean, it is. And go in that direction.
Okay.
Be a little careful of products that have anecdotal. Aunt Martha's cat did just wonderfulness, and I'll look at advertising, and to be quite honest, I'll look at advertising, and you look at a before and after, and it's not the same cat. So yeah,
I love it. Hey, you're like my newspaper. Hang on, you're like my newspaper editor who told me, if your mother tells you she loves you, check it out.
Yeah, right.
So we got time for one more question, and I want you to stay on the line because we're going to do a thing about a breed profile and some other things, and I'm going to make you a kitty cocktail, Dr. Ben. But I think Kathy has one more thing to ask.
Yeah, I just have one more question I thought he might answer. So what's the recommendation now as to preventative? How often should your cat get their teeth cleaned? Is it an annual?
Yeah.
Is it every 2 years? Is it just depending on the cat? What's the latest recommendation?
Yeah, it's a great question. And let me answer that. Hopefully I can not take up too much time because this is my passion. In an ideal world, the first dental prophylaxis is 1.5 years of age. And the reason is because they're the healthiest they're ever going to be. You knock them down, make sure there's nothing weird in the cat's mouth, strains. Ooh, what's that tooth? Kind of thing. And then the next would be maybe 3 to 5 years of age in that kind of time frame. And then maybe every year or two after that. The one thing I will say is in my career, the anesthetic agents have become so improved. I mean, when I tell vet students to come in and shadow me, what I used to use when I graduated from vet school, they give me the deer in the headlights look and, God, you're older than hell, aren't you? And yeah, because it's a whole different ballgame now, and the anesthetic agents are so freaking safe in the hands of people who know what they're doing. The oldest cat I've worked on is 24. The 24-year-old kitty.
That is a concern with most people, as they are worried about the anesthesia part of it more than anything.
Well, yeah, absolutely, and I guess, for lack of a better plug, that my colleagues in the dental college, this is all we do, and when I have people that come in, I tell them, look, I do 3 to 5 surgeries a day times 5 days a week times 48 weeks a year times way too many decades. Do the math.
Right. So especially older cats, it's worth your while to have a veterinary dentist do the cleaning.
Yes, and that's my point, because this is what we do. We deal with it. We have all the instrumentation, we have all the toys, and we know what we're doing, and we don't trash the mouth. I mean, we really help these kitties out. The younger cats, fine, or there's nothing too weird about it. The general practice that is skilled at it, sure, I don't have a problem with that. But when you get into anything that's older cats and where speed is of the essence, veterinarians will look at me and say, Ben, you do in 5 minutes what takes me an hour. I think, God, after 50 years, I hope I got it figured out. And,
good point.
I really like that, Dr. Ben. Hey, hang on, Dr. Ben. We're speaking with Dr. Ben Colmery. He is a veterinary dentist, and he is a pioneer in veterinary dentistry. We only have about 13 minutes left. We've got a lot more to cover. So at this time, I'm going to turn it over to Kathy Black, who's going to talk about blue cat breeds while I get my cocktail ready for you guys.
All right, and Teresa's going to join me also. So we're going to talk about those cats that only come in one color. And the gray cats and the cat fancy, we call those blue. So these are breeds of cats that only come in the one color, which is blue. Now we're going to include the British Shorthair in this discussion because the British Shorthair used to only be in blue. They now come in other colors. But these 4 breeds are the ones that most people get confused about, is the British Shorthair, the Chartreux, the Carrot, and the Russian Blue. Now, I could go into great detail, and I want to thank Teresa for she put together a whole PowerPoint that's mostly targeted for the judges, but I stole some parts of. But I want you to keep just a couple of features in mind. We're going to talk about the eye color, the head shape, and the ear set. Now, the bodies are all different also, and the coats are different. But just to keep it simple, we're going to focus on those 3 things: the head, the ears, and the eye color. So the British Shorthair and the Chartreux will always have copper eyes. And the Carrot and the Russian Blue will always have green eyes. So just based on the eye color, right there, you can already eliminate, is it this breed or the other breed, okay? Now the British Shorthair is a very cobby cat. It has a very broad chest. It has a round head, and like I said, the copper eyes. The Chartreux also has a very broad chest. It's built completely different with more refinement through the legs and a much different head structure. It's more oval, not round. We're going to get into a little more detail here in a minute. And the Carrot has a body that's like a spring that you push together. It's got this rib cage that feels like it's like a coiled spring, and a heart-shaped head. And the Russian Blue is more a fine bone, long body, graceful cat with an equilateral triangle-shaped head. So we're just going to look at these heads, and I love this slide that Teresa made. So with the British, everything is round. Round or rounded is mentioned over 30 times on this breed in the CFA standard. So we're looking for a more rounded head. The Chartreux is not a sphere. That's in the standard. So it's more of an oval shape. The Carrot's known for its heart-shaped head, and I love the way she has these two hearts here, both the skull structure and with the ears in the overall shape of the head. And then the Russian blue is an equilateral triangle-shaped head and a flat plane. We're going to look at the profiles here. Look at the profile of the Brit. We have what we call more of a stop to the profile. The Chartreuse is described as being straight with a slight change of direction right below the eyes. The Russian blue is called two planes, so it's straight, changes direction over the eye, straight again. And the Carrot is more of a rounded profile, as you see here. Look at the ears. The British Shorthair have these medium ears, broad at the base, quartering the head, fitting into the roundness of the head. The Chartreuse have medium ears that are upright and very erect. Even if they're sitting further out on the head, they still have an erect posture to them. The Carrot have large rounded ears that are very flared at the base, so there's a lot more distance in this part of the ear. And the Russian blues are also wide at the base, but the tips are pointed, are more rounded than pointed, and they also set far apart on the head. So the Brit, the Chartreuse, the Carrot, and the Russian blue. So let's look at the two breeds that have copper eyes. The Brit, British Shorthair, roundness, robust body. The coat is very plush and dense, just to talk about the coat. The Carrot, shame on me. The Chartreuse, more of a oval shape to the head, the very high erect ears, also with the copper eyes. A robust body, a very different coat texture, and more refinement in the legs. The Carrot with that heart-shaped head, green eyes, a coiled spring to the chest, and also a very different coat texture. And our Russian blue, the equilateral triangle head, two planes, also with green eyes. So next time you see a blue cat or a gray cat, first thing you're going to look at is the eye color. Is it green or copper? Is the head structure round, heart-shaped? And that'll help you identify which one of these four breeds. Teresa, you want to add anything?
Just the other thing is just a reminder that the British Shorthair does come in various other colors, but the blue is the most popular color of British Shorthair.
Yes.
Can we see Phoebe?
Come here, Phoebes.
It was once called the British blue, and actually early in the history, the Chartreuse and the British were all thrown together. They didn't know there was that much difference between them. So there's Phoebe with her lovely two-plane profile that we were talking about.
She's got a great profile.
And, and their coat is described as being able to write your name in it. It's very dense and thick.
You can, I like to say you can write letters to the Tsar and send her away.
There you go.
Hey, very nice job, Kathy and Teresa and Phoebe and Dr. Ben. When you get to see this on YouTube, you're going to be amazed at the knowledge base these two women have on all breed cats. What do you think?
No, that sounds pretty impressive. I have a British Shorthair. Her name is Chub Nugget.
And so what color is Chub Nugget?
Does that give you a visual?
Yes. What color?
Chub, she's gray. Chub is, he's called blue, I guess, but I mean, for me, she's gray. She's built for comfort, not for speed.
Well, that's kind of the British Shorthair build anyway. It's
yeah.
Well, it's too bad we didn't
also,
have you on live. We could have had Chub Nugget up there next to
I think we need to have him back later because I think he has a lot more to share with us. Don't you guys think?
Too. Yes.
Hey, we got a little bit of time left. I don't want to get rushed off and cut off, but we need to talk about the CCW, Cat First Aid, and I need to salute Bengals with my kitty cocktail.
Okay, so we talked about the CCW program, the Companion Cat World program, quite a bit last week because of the virtual cat contest that's going on now. But it's CFA's program to recognize the non-pedigreed cat as well as our pedigreed cats. And for a one-time fee of $13, your cat can join CFA and get their beautiful card with their cat's picture on it. And you can get all the information on our CFA website, cfa.org/CCW. And don't forget to vote with the virtual contest that's going on right now.
Thank you very much to benefit Sterling Trepking Davis.
Yes.
We're going to move right into safety. And Dr. Ben, that's why I knew about gum colors, because I'm a master instructor in pet first aid. And I'm blessed to have a dog and a cat that help me teach my veterinary approved program. And so we actually have a cat first aid class I teach. What do you think of that, Dr. Ben?
That's awesome. That is awesome, awesome.
And my cat, pet safety cat, Casey, with sometimes in appearance by Rusty the performer, are helping me. We have a class already sold out for tomorrow, but anybody that wants to take the class, it's live via Zoom. And our next cat class is going to be Sunday, March 14th. Sunday, March 14th. Now, if you have cats and dogs in the house and you want to take our cat and dog first aid class, we also have openings for the class, which is on a Saturday, March 13th. But I got to tell you, I have advisory board members that are internal, emergency, critical care, feline medicine, house calls. So I'm always learning and sharing, but I'm very blessed. And this is the coolest thing. Our class tomorrow sold out. We have somebody from Germany and somebody from Toronto and somebody from Quebec. Thank you, Zoom.
And don't forget, everybody, go to Pet First Aid, the number 4, the letter U, to find out when all the classes are and sign up.
Yeah, so one day maybe we get Chubb on the show with you doing first aid there, Dr. Ben.
Oh, yeah.
Well, yeah.
All right, we're going to end this. Yeah, we're going to end this because we always create, I'm a licensed bartender, and one of the things I love to do is create a kitty cocktail. So today's kitty cocktail with the graphic and drawing courtesy of Teresa Kiger. Thank you so much, Teresa. We are calling it the Beautiful Bengal 9 Duo Drink. And this is kind of one where you can use a tall shot glass. So to start, it's going to be smooth and creamy, and my cats are already approaching because they can smell the smooth and creamy. Get away, Rusty. So you just take a regular old cocktail shaker, put some ice in it, and then you want to put 2 ounces of Kahlua, which is an 8 count. 1, 2, 3, 4, 5, 6, 7, 8. You want to make it even yummier and add an ounce of Bailey's Irish Cream. I'm going to do a 4 count. 1, 2, 3, 4. And then to give it a little bit of an orange liqueur, you can either use Grand Marnier or Cointreau. Either one works. And you add that to the cocktail shaker. And then you got to shake this, shake it till you make it. And this is a drink for 2. So in this one, I'm going to take a couple of shooters and I'm going to put them in.
Is that for you and for Casey, or is that for you and another adult?
Oh, maybe I'll have twice. I don't know. I'm not driving. If you guys were here, I would do it. But it's really nice. Yeah. Yeah, he says, I'm over 21. Then you finish it, just to get a little hint. I like to top it with a little bit of cinnamon. So it's almost like leaving paw prints, if you will. So at this time, I will only hold up one. I want you all to raise a glass. It can be a glass of water, an iced tea, a beer, a wine, or this beautiful Bengal 9 Duo drink. And let us all toast to all cats, purebreds and otherwise. They make us such better humans. Cheers.
Cheers.
Cheers. And thank you, Dr.
Cheers
Dan,
to you.
for joining us. We really wish we would have had your face on so everybody could see your face.
And if I meet you, I'll make a drink of your choice, Dr. Ben, whenever I see you. How's that?
That sounds like a plan.
And
cool.
at this time, I really do want to give a shout out to our very, very special guest today, Dr. Ben Colmery III, a veterinary dentist. He's not just he is probably the veterinary dentist on the planet. And I have learned a ton, and I really thank you for being on the show, Dr. Ben.
Well, thanks for having me. It's been a pleasure.
Thank you so much.
And I also want to do a shout out to the Cat Fancier Association, our sponsors, Pet King Brand, the makers of Zymox and Oratine. Of course, my co-pilots, Kathy Black, and Teresa Kiger, and somewhere in my backyard office, Rusty the performer, and Casey the pet safety cat. Next week, our guest is going to be Nathan the cat lady. He's going to talk about dating. What? We're going to see more, but I really had a great time. Thank you all. Be good to your cats, and we'll see you same cat channel, same cat time on Meowy Hour next Wednesday. Cheers.